Thank you, everyone. We're going to get started in about a minute. We have a lot of great content today. Right. Well, hello, everyone, and welcome. Thank you for joining us today for the February CPS Coordinators Forum. My name is Mandy Seetaller. I am the statewide coordinator for Alaska, and I'm the community engagement representative on the National Child Passenger Safety Board. It's my honor to serve as the moderator for today's session, and we are excited to have you. If you'll take just a moment to enter your name and where you're from in the chat, we'd love to know who's joining us today. Next. As a reminder, attendees are requested to not participate in this webinar if you're driving a motor vehicle. This webinar will be recorded and you can listen to it when you're safely at your location. It'll be posted to cpsboard.org/state-coordinators/forum in 1 to 2 business days. We're usually pretty quick. We're going to jump right in and we're going to kick off with NHTSA, and I'll let them do their own introductions. Thank you for joining us.
Thank you, Mandy, and good afternoon to everybody joining us today. My name is Laura Dunn, and I work at NHTSA headquarters as the Child Passenger Safety Subject Matter Expert in the Office of Occupant Protection and Impaired Driving. And Amanda and I are going to talk to you guys today about the Bipartisan Infrastructure Law, the National Road Safety Strategy, and later some of our states are going to share some really exciting work that they're doing to support child passenger safety in their states. So we are going to take a bit of a speed run here through the beginning. So overview of what we're going to talk about today. Next. So as you guys know, next please. Thank you. As you guys know, as part of the Child Passenger Safety Program, the whole National Child Passenger Safety Technician Certification Training Program is a partnership between 3 organizations. So the first of which being NHTSA, we developed the original curriculum and we're committed to providing regular updates to that curriculum. The National Child Passenger Safety Board maintains the quality and the integrity of the curriculum, and the National Safety Council manages the activities of the board. And Safe Kids Worldwide, who's the certifying body and is responsible for administering all the aspects of the CPST certification program. Next. So, as you know, NHTSA is located within the larger U.S. Department of Transportation. And the mission of the DOT is to deliver the world's leading transportation system, serving the American people and the economy through safe, efficient, sustainable, and equitable movement of people and goods. Next. NHTSA is a mode within the Department of Transportation, and we are responsible for keeping people safe on America's roadways. Next. So the National Highway Traffic Safety Administration was created by the Highway Safety Act in 1970, the Highway Safety Act in 1970. So we accomplish our goals by setting and enforcing safety performance standards for motor vehicles and motor vehicle equipment through grants to state and local governments to enable them to conduct effective local highway safety programs. In addition, we also investigate safety defects in motor vehicles. We set and enforce fuel economy standards. We help states and local communities reduce that threat of drunk drivers, promotes the use of seatbelts, child safety seats, airbags. We investigate odometer fraud and establish and enforce vehicle anti-theft regulations and provide consumer education on these motor vehicle safety topics. So our 4 kind of main areas are regulatory, research, behavioral change programming, and grant administration. Next. So as I'm sure you guys are aware, there are 10 regions within NHTSA, And our Office of Regional Operations and Program Delivery administers over $500 million in grant programs annually to the 50 states, the District of Columbia, Puerto Rico, and the U.S. territories, and the Bureau of Indian Affairs. So under Section 405, NHTSA awards grants for occupant protection, state traffic safety information systems, impaired driving countermeasures, distracted driving, motorcyclist safety, state graduated driver licensing laws, non-motorized safety. And these regional offices really help states to identify their highway safety problems, evaluate safety programs and activities, and provide technical assistance and training to folks that are involved in these programs. Next. I want to share with you guys some traffic safety data that we all keep in mind as we work on these programs. Next. So in 2021, as you guys know, 42,939 people died in motor vehicle crashes in the United States. It's about one person killed every 3 minutes and an estimated 5 people injured every minute in traffic crashes. And this is collected by our friends at the National Center for Statistics and Analysis. As you guys are well aware, in child passenger safety, an average of 3 children are killed every day in the United States in traffic crashes. Next. So in 2020, deaths from crashes resulted in over $430 billion in total costs. This includes medical costs and cost estimates for life loss. And indeed, for the same in 2020, for the ages of 1 to 44, unintentional injuries were the leading causes of death for individuals, and specifically motor vehicle crashes are the leading cause of death for unintentional injuries for individuals between 5 and 24 years of age. And that's from our friends at the CDC. Next. Next. Oh, I'm sorry, go back one. Thank you. So you guys are intimately familiar with all of the challenges that we have in child passenger safety. Of those fatalities that we had in 2021, 1,184, about 3% of them were children that are 14 and younger. And child traffic fatalities increased by about 8% from 2020 to 2021. Lots of injuries for children in traffic crashes, about a 17% increase from 2020. And based on restraint use, about 69% of children riding with unrestrained passenger vehicle drivers were also unrestrained. So we know that connection from the work that you all do. Next, I'm going to hand it over to Amanda. That's going to start talking about the National Road Safety Strategy and the Safe System approach.
Good afternoon, everyone. My name is Amanda Jackson. I am the NHTSA Regional Representative for the board, and I am Alabama's Regional Program Manager. I'm going to talk to you all today about the National Road Safety Strategy and the Safe System approach. Next. The National Road Safety Strategy is DOT's comprehensive approach to significantly reducing injuries and deaths on our roadways. We have the ambitious goal of reaching 0 roadway fatalities, and this is going to take a cultural shift of the American people to treat roadway deaths as unacceptable and preventable. Next. We'll do this through the Safe System approach. The Safe System approach is a data-driven, holistic, and equitable approach to roadway safety that strives to integrate the needs of all transportation safe system users. It is based on the concept that everyone plays a role, including those who plan, build, and use our transportation system. It involves everyone, prioritizes the safety of everyone on our roadways, and focuses on the people and how the infrastructure serves them. Our principles are death and serious injury are unacceptable, humans make mistakes, humans are vulnerable, responsibility is shared, safety is proactive, and redundancy is critical. Next. The elements include safer road users, safer vehicles, safer speeds, safer roads, and post-crash care. Next. You can see on this slide right here, there is a lot of detail. Historically, Department of Transportation has taken the traditional approach to reducing serious injuries and crashes on our roadways. We are moving towards the equitable safe system approach on the right. We want every community to receive the safe system approach equally to make sure our communities are as safe as possible. Next. So our top 3 takeaways. The safe system approach is principle-based. It requires all 5 elements to be strengthened, and it's a continuum, not an absolute. Next. The Department of Transportation and NHTSA has really focused in on equity. The next slides will explain this. You can see in this slide right here that inequality, everybody received the same solution and the same bike, despite their different needs. Looking at equity, specific needs are taken into account and addressed for each individual. In the equity picture, all individuals can ride the bike that meets their needs. Next. There are two definitions that we're going to be focusing on today as defined by Department of Transportation. The first is an overrepresented population, and this is a disproportionately large number of a particular category or type of person impacted through data. So for example, we know that young adults are more likely to be killed on our roadways. Underserved communities are populations sharing a particular characteristic, as well as geographic community that has been systematically denied an opportunity to participate in economic, social, and civic life. And this is an example would be our Native American population. Next slide, please. The blue bar graph is our traffic fatality rate. The green bar graph is our pedestrian fatality rate. And you can see here that American Indian and Alaskan Natives are not only overburdened, but they're also overrepresented in this graph. Next. So now I want to focus on the Bipartisan Infrastructure Law and public participation and engagement. If you're housed in a highway safety office, you're probably very familiar with this. But again, we want to highlight all the work that our agency is doing. Next slide. Public involvement is a process that proactively seeks full representation from the community and taking these comments into growing a project or program. The public is anybody who cares about transportation, whether you work, live, or have an interest in it. And it helps with our sustainability and making sure our programs meet our community needs. Next. This is the model that we're using at Department of Transportation, and you can see that there are several steps involved to make sure that we're getting that good feedback from our partners and communities. Next. This is a guide that has been developed by Department of Transportation. It talks about evidence-based examples and successful case studies of agencies across the country doing work to get this public engagement feedback. Next. So two things to note about the Bipartisan Infrastructure Law. We now have a requirement for states that they must use a portion of grant funds each year to educate the public regarding the risks of vehicular hypothermia. We want to prevent heat stroke prevention deaths in children that may have been left in vehicles by adults. Next slide. As Laura mentioned earlier, our states apply for 405 funding. They submit an application to NHTSA to receive different funding sources. Your program may be funded by 405. And one of the things states need to do to qualify is submit information about their state, including details on CPS inspection stations, as well as the number of technicians. And when states receive this funding, they can use it to train professionals and work with parents on educating them in child restraints, supporting CPS services, and working with low-income and underserved populations with recruiting, educating, and purchasing car seats. Next slide. I'm going to ask the regional program managers to come on camera when your state is called. There's 10 of us at the agency that help all our states with any questions and technical assistance you may have. So Region 1 for the Northeast, we have Diana Gugliotti. Region 2, Shannon Hughes, are also our Northeast states. Region 3, we have Josh DeFisher, our Mid-Atlantic and Southern states. Region 4 is myself, our Southeastern states. Region 5, we have Casey Ray, and she does our Midwestern states. Region 6, we have Frank Monero, Texas and the surrounding states in our central part of the US. Next slide. Region 7, we have our Plain states as well as Arkansas, and this is Dean Scott. Region 8, we have Brenda Hahn, who serves our mountain states. Region 9, we have JD Ramirez, who serves the West Coast. And Region 10, we have Lynn Zanto, who serves the Pacific Northwest in our islands. So again, we're all happy to help, and we want y'all to be as successful as possible in implementing programs. Next slide. Here's our contact information. Next slide. These are references. And then I'm going to turn it over to Connecticut for their presentation. Thank you all.
Good afternoon, everyone. Welcome. My name is Juliette Little. I am a program manager in the Connecticut Highway Safety Office. I'm also the state contact for CPS. I have two colleagues here with me today, Brent Aiken and Nick Asif from Yale New Haven Hospital. So let's get going. So what we're here to talk about today is bridging the gap so that everyone, all children can travel safely. So we get there by meeting people where they are. And what I mean by that is going out into the community, not having them come to DOT, but we're out in the community to meet with the folks to talk about what their needs are and what we can do to assist them, not them making it inconvenient for them to come to our place of business. And so that way we build that trust with the community, which is critical. Next slide, please. So I work with hospitals, Yale New Haven Hospital, Connecticut Children's Hospital, Griffin Hospital, and we work with a few police departments. And with those stakeholders, we collaborate with our message and what we need to do in the community. And by working with these folks, they're the boots on the ground that go into the communities to talk with and engage with community leaders to build that trust, to let them know what we can do to help them, not what we think they need, but what they tell us what they need. Next slide, please. That's my contact information. I didn't want to take up too much time because of our two programs. I want to give Brent and Nick all the time to showcase what we're doing here in Connecticut. So Brent, you're up next.
Good afternoon, everyone. My name is Brent Aiken. I am the Hang Time Coordinator in Connecticut. People ask themselves, what is Hang Time? Hang Time is a community support group, obviously, and what we try to really promote is our social service navigation hub. We really deal specifically with the reintegration of incarcerated citizens coming back, as we like to refer to them as returning citizens. It started in that aspect, but now we're growing into all of our communities in our larger cities of Bridgeport, New Haven, and Waterbury. Some of the things that we do, and I think one of the biggest differences in our program that we have is that we never overpromise or underdeliver. We follow up with agencies that a lot of times use check boxes when they want to gather data to obviously receive money. Hang Time also is a co-ed gathering for real talk. When you deal with reintegration, you're also dealing with people who need to trust you. They need to believe in you. And being 24 years in law enforcement, coming out of that and retired back in April 22, that posed a challenge for me. But once I made them understand who I was, the roadway is now paved and we are really progressing significantly. In Hang Time, we promise three things: a hot meal. You get true respect to speak your mind, not what you think others want to say, but if you're really upset about something, you can continue and move on through there. We also provide them something different, an educational piece that they may not have known before they attended. Next, please. Started in 2014, Charlie Grady. Charlie Grady was a former Hamden law enforcement officer, moved to the FBI, where they created this group with U.S. Attorney Mark Gustafson. They started off with 8 gang members. It was a very interesting start where two guys that showed up for the first meeting ended up taking gunshots at each other 2 days before. By the end of that meeting, they were both recognizing that they had more in common than they didn't. So obviously you can see as you go through this, the numbers have grown since 2014, and specifically in the last 18 months, we've gone anywhere from about 30 people in Bridgeport. Now we're averaging 65 to 85, as well as the other cities that we have. Next slide. Through this organization, we've also created things that we recognize. Her Time. Her Time is specifically for women because we recognize women need to have their own forums and be able to speak freely in a safe and trusted environment. No men are allowed to attend these sessions. Not even when I deal in child passenger safety. I'm working on that now to be in a different room when we actually have these things. Choices and the Hang Time Mobile are two different pieces of this. We recognize that we want to deal also with the mentoring youth of athletes who are normally the big people on campus, male and female. And we've been asked to be in some of our larger school systems in Waterbury and Bridgeport on a full-time basis, which unfortunately we cannot dedicate our people to currently at this time. So we try to get there at least twice a month. Hang Time Mobile, we recognize in underserved communities, a lot of people never get outside of their own communities, whether they're in prison and they come back to those communities. So we provide them an opportunity to get outside of that and go to museums, venues, cities that they may never have seen before, except on TV. Next slide. Connecticut Hall of Change is something that Charlie Grady's extremely proud of. This is where we have formerly incarcerated people who have come out and not only made a difference in their lives, been clean of law enforcement criminal activity for over 5 years straight, and then have made significant changes in their own communities, meaning helping other people. They've cleaned up the areas they destroyed when they were there. We also offer scholarships, and Charlie has also written a play. Next slide. So what do? I provide child passenger safety awareness training. I offer my services in that realm to people who, any caregiver who needs any assistance in the ages of obviously of 8 or under in the state of Connecticut, which are required state laws. The awareness training is about 45 minutes, and I provide that in a separate room so the other participants don't miss out on their meeting at that point in time. We discuss many different factors, obviously within the awareness arena, about the parts of the car seat, different items within it, objects within the vehicles, etc. All some of the main touches of how to use that seat properly with the children that they provide the information to me for. As long as I have that information ahead of time, we're good to go. So moving forward, the statistics that we started this last year, we have 6 different affiliations. Those are the cities that we cover. We did, I believe, 22 car seats last year, 32 I inspected. And then this year so far, we've distributed 8. I have 12 seats inspected, and that's only through January so far. I already have 5 lined up ready to go for March, the beginning of March at this point. Next slide. These are our contact. We love information, passing it on all the time. If you want to find out who we are, what we do, please take a look at that and click on it. We're a very unique organization in that we truly have that passion that Juliet spoke about helping our inner cities, helping our underserved communities, and making sure that all the children are safe. Next slide. That is my contact information. And obviously, we're here to assist in any way we can. If anybody has any questions, obviously, we'll have the Q&A afterward. And I'm going to pass my torch on to Nick Asa.
Thank you, Brent. Good afternoon, everybody. So again, my name is Nick. I'm the manager for the Center for Injury and Violence Prevention at Yale New Haven Health. It's one of the 2 major health networks in Connecticut. We have a long-time standing relationship with Juliet and her office at the DOT. What I'd like to talk to you today about is our program that we titled Targeting Disparities in Child Passenger Safety. We can move on. So as I mentioned, we have more than a decade, I believe, more than a decade for sure, relationship with the Department of Transportation through grants and collaborative projects, many of which are related to child passenger safety, which we're talking about here today. The DOT Highway Safety Office with NHTSA funding provides us several grants. We have one grant that is to support fitting stations throughout the state of Connecticut. So we have a dedicated full-time employee that actually works with all of the technicians and all of the fitting stations throughout Connecticut to ensure they have the resources they need, both tangible assets and education. We work with the DOT to provide continuing education workshops throughout the year in various parts of the state, so it makes it easier for people to get to, based on where they are. It provides all the CEUs needed for recertification in a cycle. We also provide this year we have 5 or 6 4-day classes planned for the certification. We have another grant, which is the Targeting Disparities Grant, which I'm proud to talk about today. This was something that my program pitched to Juliet in her office about 2 years ago. And with the idea that we had seen clear and defined vulnerabilities and demographics demographics that were not getting the services and support that they needed. Can we go to the next slide, please? We launched on that. Now, I will tell you a little background of our department. We have 5 dedicated employees specifically to child passenger safety. So with those FTEs, that includes the grant-funded ones from the DOT. And so what we did was, I mentioned, we identified the demographics. So we really looked and found that especially African American, Hispanic with Spanish speaking, and also refugee populations were really not getting to the services. And there was many factors about that, but most of them were socioeconomic. A lot in Connecticut, a lot of our fitting stations happen to be at police stations, which unfortunately it's a fact that there is a fear for many of these people in these populations to go and visit a police station, not only for fear of judgment, but also worried about getting in trouble. And we also have another factor that fits in here with children with special health care needs in transportation. Next slide, please. So the real gist of the Targeting Disparities program is to have dedicated FTE, full-time equivalent, bilingual Spanish-English speaking staff that are dedicated to child passenger safety. Last May, so it's almost a year, a little less than a year, we brought on our first child passenger safety technician that was for this role, and she is fluent bilingual English-Spanish, which is something that we did not have before. Of course, in a health system, we have translation services and whatnot, but it's not the same. So really, the idea of this is getting someone that can assimilate, that can relate with different demographics and populations and get that buy-in. So we talk about those relationships, and these are very important. And Juliet touched on it in the beginning when she said, not telling people what they need, but asking what they need. And this is so important, especially in the vulnerable populations. It's all about building relationships, and in doing so, Rosangela is the employee that I'm talking about, and we also have a second full-time position posted currently for this program. But what Rosangela has done is she has worked with our government relations office, with our other various hospitals and delivery networks throughout the state of Connecticut. In many of those locations, we have, also grant-funded programs that help people in need and really get to these same populations. So we had that overlap, and so we've leveraged that to get connections with faith-based organizations, with Head Start programs for early childhood, with different programs that help people in socioeconomic issues. So what we've done is we've had meetings with these folks, and we've done it in a very collaborative approach where we go to them and we say, look, this is the services and this is the education that we can provide. What is the best way that your community would receive this? And we listen. And literally, so we offer our information and then we sit and listen. And the amount of information that comes back in response is very eye-opening. It really is, because people have problems getting, across to places, when you can't make it to a fitting station. So the idea of going to them. And, we've always in CPS have always done community events and had things like that, but this is more targeted. So really setting up things that are at different times, especially for working people. They might not be available during the day. Neutral sites are very important for the education, where they can go in a place that they're comfortable, a community center or something like that they regularly go to. Offering these services there is game changing. And then with regard to the special healthcare needs, we really try to target that in the same approach. Next slide, please. So I mentioned we currently have one full-time position dedicated to this role. We have one posted. In Connecticut, if you know, we're a relatively small state compared to others, but the southeast corner of the state, recently we've developed new fitting stations. We've worked with organizations to get techs, to get people certified as techs, and we're working collaboratively with them. We also, Brent, in his presentation mentioned the city of Bridgeport, which is one of our largest cities, right? And it is full of vulnerable areas. So what we did when we developed this program is we looked at the Justice 40, census information. We worked with the DOT, with NHTSA to identify these areas, and those are the areas we're targeting. So we're starting out small, and we plan to expand, but really getting it right from the start is what's important. And then finally, working with an awareness campaign, working with our marketing team to get promotional material out there in various languages, English, Spanish, Arabic, Hindu, all different types of languages that we serve, so we can get to those people. Next slide, please. So, I kind of covered most of this, but really it's all about awareness. It's about awareness and making sure that these populations know that we are here for them, and that is the approach we're taking. So we are gracious to have NHTSA funding through DOT to offer these education sessions, and when appropriate, car seats, because we never want people leaving an event or an education session with a child in either unrestrained or in the improper seat. So we do have seats on hand for that. So I would love to, give a wrap up to, a year from now. Juliet can share with all of you, some statistics, but I think we're going to really go places. Next slide. And that is it. So with that, I will turn it back to Juliet if she has anything else to say, and then we'll hang on for questions later.
It's just one thing I wanted to say with Brent in the program in Bridgeport for Hang Time, how it's expanding. I want everyone to know it's not just those that were incarcerated. Those folks go back to their community because they love the program so much. They get so much from it. They feel that it's such a benefit. They tell family members, other folks in the community. So it's a lot of people that get the benefit of these meetings. And I'm going to let Idaho go ahead.
Thank you. Can everybody hear me? Perfect. So my name is Carmen McKinnon. I am the state coordinator for child passenger safety in Idaho. Next slide, please. A little bit about myself, but today I'm going to talk about where we are at in Idaho, how we've progressed over the years, how we started out with the program. And then I have two liaisons from the state of Idaho that's going to be joining me talking about the refugee program that is very active in southern Idaho and western Idaho. That is Jen Westendorf, and Brian Rauscher will be joining us as well. He will be talking about rural education in Idaho. So I would like to share with you a little bit of history about Idaho, where we're at, and how we're going to move forward, trying to help those families in need in rural Idaho. Idaho is a very rural area. Next slide, please. So what do we look like? We have a population of about 83 million, or excuse me, 2 million. We have our mileage, square mileage around the state is about 83 million. A lot of area to cover. 33 of our Idaho counties are in rural areas, which 16 of those are very remote with about 6 per square mile. You can see that most of Idaho is 70% urban. We have 10% living in that living below that poverty line. 13% of our population is Hispanic. Most of our area is all agricultural area. That's rural Idaho, and that's where our families in need are at. Next slide. So a little bit of crash data here. Our state law is children through the age of 6 must be properly restrained in child restraints. So 12 children 0 to 6 years old were killed in motor vehicle crashes in the past 5 years, 2018 to 22. So I was doing a little bit of research on that to find that 12 fatalities from 8 crashes in the past 5 years. 4 children were not belted, 8 were belted. One car had 3 children die, another had 2 children die. One child that died was being breastfed in the back seat when the car crashed. So for us here in Idaho, looking at our numbers, 50 children were in fatal crashes, but the fatal crash was involved, but not the child. And of those 50 crashes, close to 60% were in rural Idaho. We definitely have some work to do. We definitely have a lot of education that needs to be provided in those rural areas. So next slide. Here I want you to be able to see in Idaho where the urban areas and where the clusters are in Idaho. So we have highly populated area in eastern Idaho and western Idaho. And then in northern Idaho, we have that big section in the center that's rural Idaho. We don't have, there's a lot of ground there to cover that are in urban areas. Now in those lower areas where we have a lot of population, big populations, larger cities, but still a lot of rural country that we need to make sure that we are helping those families that are underserved with any resource and all resources in regards to child passenger safety. Next slide. So how do we make a difference in Idaho? And I have to look back at the years past. I've been in this field for a number of years. We were very blessed in Idaho to have 4 active coalitions that Safe Kids coalitions that focused a lot on rural education, rural car seats, providing check sites throughout the state. As you remember, back when we were with Safe Kids, we had funding to do that. What changed in in Idaho was we've lost all of our Safe Kids coalitions. We had a great program in southern Idaho with Magic Valley Safe Kids Coalition. We partnered with our public health district. We supplied car seat classes in both English and Spanish. We had an Hispanic interpreter that also became our state's only certified technician / instructor. So he was a great benefit to the program. We served an 8-county area. And I can say in the 5 years that I was with that program, the last 5 years, we were able to provide car seats and education through the WIC program on a grant with our community hospital. And we provided over 3,000 car seats and education to families that were in need through the WIC program. So pretty proud of that. So we no longer have those programs, those coalitions in Idaho. And we started moving forward with how do we build Idaho and get back to providing that information and providing the educational resources where needed. Next slide. So in 2016, we activated our child passenger safety program. In 2015, that's where we were at with technicians, instructors, and inspection sites. To date, we now have 322 plus technicians, 25 instructors, and 89 inspection sites throughout Idaho. We implemented our liaison team back in 2021. We have 1 liaison per public health district, and we have 1 tribal liaison to serve our Idaho's 5 tribal nations. Now, I will note that 5 of our 44 counties do not have a child passenger safety technician, and I'll address how we're going to move forward with helping those 5 counties out. Next slide. So this is our state of Idaho, and this is where we have all of our technicians, our instructors located. Yellow is our technicians. The teal is our instructors. Red is our tribal members that are part of our technician team. We also have identified our special needs. We are scattered completely throughout Idaho, and inspection sites at most of all of those locations where they're identified. Our inspection sites are provided car seats. They are provided educational material through the Office of Highway Safety. All of our technicians have access to all the educational material. Those 5 counties that don't have technicians located at them, and we've tried very, very hard to get them. They're very dense populated areas. So our focus on 2024 will be to possibly get maybe a technician in those areas, but really truly taken our program to them to offer them the resources the resources they need to safely transport their children safely and correctly. The education material, having an event there, and providing car seats to families in need. Next slide. So we have 7 liaison members, 1 for each one of those health districts. You can see what the population base is and how many inspection sites each one of those liaisons are responsible for. You will see in Public Health District 4, it is a fairly large health district, but it's also one of our areas that is urban and very highly populated, of course. So we have a lot of check sites there. We have several throughout the state to try to help those families. Those that are indicated with a star, that is where all of our tribes are at, and that's where we have our 1 tribal liaison, helps manage and provide any resources to any one of those tribes in those areas. Next slide. I pulled up the data from what we have done in the past since starting as a state coalition, and looking at the number of checks we've provided throughout the years, the number of seats, the number of materials that we've provided, all of our volunteer hours. We couldn't do this without all of our dedicated techs in the state, and how many seat checks that we provided on Seat Check Saturday. The last few years, we've had a lot of Seat Check Saturday events, and we've had a lot of people served within a short amount of time. Those events were provided, some in rural areas, but a lot were in the urban areas, in the rural areas, which just go to show me that we provided a lot of checks in those rural areas, and we received a lot of people coming to those events. So if we can do that in a week's time, we can surely do it throughout the year all over the state. And that's by providing our techs, our liaison team, with all the resources and funding that they need to help make that happen. Next slide. So changing our focus in 2024. The last few years, we've provided 13 trainings per year. We've added multiple check sites. We provided everybody, all of our check sites, with an iPad to use the NDCF program. Each year, more events were planned on the Seat Check Saturday. Like I said, that just gave us fantastic results of what we can do in rural Idaho, those families that we're helping. We established MOUs with each one of the check sites, and they are required to offer at least 1 event per year. So in 2024, moving forward, we're going to continue with those trainings. We're going to continue hosting renewal classes. The liaisons will be asked to host at least 3 rural education car seat check events per their health district, and that will be focusing on rural locations and encouraging other CPSTs to take part. Those events should take place in locations other than the inspection site, and then hosting quarterly meetings to keep everybody engaged. With that, I'm going to turn that over to Jen Westendorf. Thank you.
What's going on with this?
Hi there. I'm Jennifer Westendorf. We'll be going over meeting the needs of diverse populations. I'll be covering refugees. Next slide. I have been a CPST since 2001 and currently work for St. Luke's Children's Injury Prevention in the Magic Valley, as well as being the Region 5 lead.
Like I said, you guys can, you can move upstairs. That the more the merrier.
Next slide. So we're going to cover the programs, how we get those classes done for them, our unique challenges, our influx of Peruvians into the state, and then our community partnerships. Next slide. Okay, so College of Southern Idaho houses our refugee program. This program was founded in 1980, and we have anywhere from 250 to 275 refugees get resettled into our valley every year or more. That's kind of the average. So they receive benefits from the time they arrive for 8 months, and then they are completely put into the system as workers, and they are able to get any benefits from our state that they might need. Next slide. We serve 28 different nationalities. recently from 2012 to present, that list that I have there is who we've been having come in every year. And so those are our main focus right now with interpreters and teaching these families CPS. Next slide. So they have their own social services through the College of Southern Idaho when they arrive. They receive financial aid, health screenings, all of those kind of things. Their onboarding is about 3 weeks from the time they get off the plane to when they're basically kind of released to start working and doing things within the community. During that 3 weeks, about day 3 or 4, we go in as not only the state liaison and CPSTs, but St. Luke's Children's goes in and we teach a CPS class to them. This class isn't your traditional class. This is a hands-on. We've worked ahead of time to get the children's ages, weights, all of that, height. We take seats. We make sure that each family has the seats that they're going to need for that specific child or children. And then we go over those seats step by step with an interpreter with those families. Every child that comes through that is able to sit in, be put into a car seat is. And we go through this with them to teach them proper use and installation. It usually takes about 4 hours in total compared to a 30-minute car seat check, which would be standard. Next slide. Our unique challenges is they don't own vehicles. So they are literally installing and uninstalling a seat every time they get into a car to go somewhere. So we have to really make sure they grasp and understand how to put that car seat in safely. We have huge language barriers there and cultural obstacles. A lot of these people have not used vehicles as transportation until they come to the US. And so it just the overwhelming things that they go through with this onboarding and adjusting to the lifestyle here is very difficult. And so we try to keep it very simple. We try to make sure that they're comfortable and that they're grasping what we're doing. And we just slow down and work with them until they get it. One of the biggest roadblocks that we have is interpreting and women CPSTs. And I say that because a lot of these cultural differences are the male dominated societies don't want to deal with a woman, but we have mainly female CPSTs. And so we address that very carefully with being extremely respectful, making sure we talk to them, not at them, just practicing all of the things that we learn in the CPST class, and just working step by step, and a lot of times using the interpreter to really do more of that communication for us, with us kind of being gentle on how we do things. Working with local authority and laws can be difficult. They are afraid of law enforcement a lot of time. And then communal living, making sure they understand that each car seat fits their child, and they can't just put any kid into any car seat and have it be okay, that they have to be fitted properly. Next slide. Our Peruvians. So our Peruvians are not a part of the refugee program, but they are resettling here up in the Wood River Valley, which is where Sun Valley is. There's a lot of construction and jobs up there. But when we talk about resettling, and I'm talking like within the past 2 years, 5,000 to 6,000 migrants have come. And so it's put a huge tax on our community up there, both for housing and for financial and needs. So the hospital, St. Luke's Children's, is providing as many seats as we can. The Office of Highway Safety has been helping provide seats. And then there's a huge community outpouring up there to make sure that they get the things that they need for their families. And we have Spanish-speaking CPSTs that work with these families to make sure that they understand. Next slide. So our partnerships, of course, Office of Highway Safety is huge. Without them in the state, with all of our checkpoints, it would be very difficult to make sure these families are getting what they need. St. Luke's Health System is the largest health system in the state and the only children's hospital. And so we have a lot of outreach through St. Luke's, and we work with the Office of Highway Safety the best we can to get things taken care of. Our refugee transportation system, so the CSI, the College of Southern Idaho, has vans that they transport families in. They also work with us at the Office of Highway Safety and St. Luke's to let us know, hey, we've got this expecting mother coming in. And then we do all the educational stuff before they deliver, so that hopefully once they deliver, we can work with them with their baby. Our WIC program is heavily involved. Community ambassadors, those are the translators that we use for the various languages, and they are becoming CPSTs because as Nick reiterated, or I'll reiterate what Nick said, you have that the ability to explain it better using a translator of their own language and really diving in. They have to change the way things are worded because they don't structure sentences the same as we do in other countries. And so it's really hard to even use an interpreter that doesn't understand car seats. So we have started to put them through the CPST program over the past 10 years and seen huge success with proper use and just better installation all the way around. Next slide, please. Our next step is getting interpreters trained. That's what we're focusing on down here. Working with the Refugee Center. This was our class this past summer that I taught with Karma and a few others. And we had 5 different languages represented in that class. So it's huge to break those barriers and be able to help those families. And so building your relationships with your interpreters that you're using and pulling them into your CPST program is key. Next slide, please. And that's it. Thank you.
Okay, can everybody hear me? Hopefully. Perfect. Okay. Hi, everyone. We're Safe Start. Next slide, please. So we've been serving inland Northwest families since 1961. This is just a brief overview of kind of what we provide. Next slide, please. So today I'm here to talk about my little passion project, our REO program, which stands for Rural Education Outreach. Has nothing to do with Speedwagon. It's just a cool coincidence. Next slide, please. So this all started because I was bored. Summer of 2021, right? COVID was 2020. Completely screwed up all of our lives in child passenger safety. We couldn't meet with people anymore. We couldn't be, and I'm a very in-person kind of person. So summer of 2021, I was talking to my wife, who I also work with, and I said, I'm bored. Like, I want to go do something cool. So we decided to for CPS week 2021, let's just go south in Idaho and go to some small communities and just see what happens. So we did, and we were completely shocked by what we found. It was kind of like stepping back in time about 20 years safety wise. And then we came back after that week and we really started to do some research on like statistics, and what we found was shocking, right? And this is just one. Children in rural communities are 5 times as likely to die in a car crash and 6 times as likely to be using non-age appropriate restraints, right? There are so many statistics that you can look at that talk about rural kids in rural families experiencing poverty, and just they don't have the same chance. So next slide, please. So we decided to do it. We put it together, and we officially launched it in May of this last year. And these are our amazing friends from Buckle Up for Life. They are incredible. They actually bought us our new Toyota Tundra to run this program. And so this is a joint collaboration between us and Buckle Up for Life and other various funders. But this is our ribbon cutting. Next, please. Here's an example of what our trailer looks like when we hit the road. So what our REO program is going to do over the next 2 years, we're going to serve 24 rural communities in Idaho, Washington, and Montana, each twice a year. Okay, so what that means is we go to these 24 rural communities, we do 3 to 4 hour check events where we talk about child passenger safety, safe infant sleep, and other infant and child health and safety issues, and we give them access, right, to the tools once they've received the education. So we, based on what we did in our first cycle in 2023, 2024, we are estimating our REO program is going to distribute about 537 new car seats, 67 portable cribs, and 360 sleep sacks to these rural communities. We're also going to remove and destroy over 250 damaged and unsafe or expired car seats, which we found out is a big deal. Okay, we found out when we started doing this that once these resources get, these old, expired, beat up car seats get into these communities where you can't replace the resources, they just kind of circulate. So now if you have an unsafe car seat, I tell you, hey, awesome having your kid in a car seat. We got a better option. I'm going to trade you. And then we get rid of that car seat. We take it out of the community so it doesn't just recirculate. Next, please. So we do this. The biggest thing that we do that makes us successful is we partner with local community organizations. And we have over 100 active partnerships at Safe Start with various community, hospital, first responder, EMS organizations. And we're really, really, really good at it. So we establish partnerships. We use them to help us reach the populations that we're specifically trying to get. And we've been very, very, very successful. Next slide, please. Here's the flyer that we distribute. We make these, we have a graphic artist on staff. That would be me. We're a very small nonprofit, so we do a little bit of everything. And heavy social media presence. We distribute these posters to our partners, and we've been incredibly successful. Next slide, please. So here is an example. This is one of our check sites. This was in Lapway, Idaho. We're all smiling because the check hadn't happened yet. Right after this picture, I think we checked 45 car seats in 3 hours and distributed 36 new car seats. So next slide, please. So what are we trying to do? The ultimate goal of our whole program, right, is to create safety stations in these communities that don't exist. So by working with these local partner organizations, like our goal is to get some people that say, like, hey, like we could use some volunteers to help us run this event, and then we show them how exciting, how fun, like it is, right? And we get them in. And so our goal is to create safety stations where these communities have access all year round to the services that we provide, and we continue to support these safety stations. So we've done one 6-month cycle of our REO we've completed so far, and we already have 11 safety stations established in our 24 communities. So we've been very successful so far. Next slide, please. Here's just some real quick, and I'm going to pay attention to my time. Real quick, you can see these are the 9 northern counties that we consider our service area. And in many of these counties, our REO program provided over, 70, 80, 90% of the checks in these counties in Idaho. So there's a little graph. Next, please. In Kootenai County, we're pretty much the only game in town. Our brick and mortar location, our office, we provided 338 of the 340 reported car seat checks in Kootenai County last year. So we still do this too in conjunction with our REO. Next slide, please. And then here is a real quick map of the communities that we serve. If there's that circle, it's a 6-mile radius circle, so it's 12 miles around. We consider that our area of service. So the whole point of our area program is bringing these services to people and eliminating as many barriers as possible and giving them access, right? Like providing access to people that just don't have access. So here is all of our service areas that we've picked. And then next slide, please. And then we're really, this is some data that we've gathered. And as you can see, the light brownish, that's rural. The very light teal, like that, not teal, but beige, that's here in our office, in our urban area. And then our checks with tribal nations that's the gray, that's insane. But as you can see, like, right, what we're finding is what the data tells us. Next slide, please. And then we're really proud. Our REO program covers more than 19,700 square miles in Idaho's 9 northernmost counties. In fact, 67% of Idaho residents in these 9 counties live within 6 miles of one of our REO events. So next, please. And then this is just what we do. We are working our butts off to ensure every child celebrates their first birthday and beyond free from preventable death and injury. And that's what we do. And if anybody's interested in hearing more and more in depth, if you're at Lifesavers, I'm presenting on the last day of at one of the conferences. So I'll have much more detail. But next slide, and then I think that's it. Yes, so if we can be of help with anything, please let us know. This REO, this is like my passion project and it's amazing. We love it. So if we can be of help, let us know, please. Thank you.
Mandy, you're muted.
Dang it. Sorry. I just want to say thank you to all of our speakers. I'm feeling incredibly inspired and a little bit in awe. You guys are pretty amazing. I think we'll hold questions for just a quick minute. I'm going to share a couple of items with you. And then if you'd like to ask some questions, I think some of our speakers can stay on. We do have 2 upcoming CPS coordinators forums, March 27th and April 24th. On March 27th, we'll talk about how to leverage your data to support your program, and pediatric vehicular heat stroke on April 24th. Next slide. There is a webinar coming, the Car Seat Detective, Compliant, Non-Compliant, or Counterfeit. And that registration will be available in the next couple of days at cpsboard.org/webinars. And this is a secret, but there is a scan code down at the bottom of this little social media tile. Dr. Marilyn Bull is going to retire from the board after over 25 years of service. She's not retiring from her regular job. This is just from the CPS board. But if you'd like to take a moment and share a photo, share some kudos, we have all learned so much and she's been such a great inspiration to us all. This is a free board. You can post a message and we'll share that with her in May. Next slide. Okay, thank you. So again, this recording will be available in a couple of days at cpsboard.org/CPS-coordinators-forum. So we'll take a few minutes to do a few questions for those of you that have to hop off. I know meetings can be back to back, but again, to our speakers, thank you so very, very much. You guys are amazing. It looks like one of the questions we had about how you obtained seats, that was for Jennifer Westendorf, and that I believe got answered. Unless Jennifer, you'd like to add a little bit more. The question was about how you get your seats for your refugee program.
Our seats are provided by the Office of Highway Safety through a grant, as well as through funds coming from a foundation at St. Luke's Children's Hospital. So we collaborate with each other and fill the need as needed from both pools. So we work as a team.
And I would say in Connecticut, it's very similar. Our relationship with the Highway Safety Office and Juliet Little and her team through grant funding.
Karma, did you have anything to add too? You were very responsive in the chat. I sure appreciate that.
Sure. So I'm with Jen Westendorf. So all of our seats are provided through the Office of Highway Safety, through the Idaho Child Passenger Safety Program. I'm on a grant with them, and so we all work together with all the inspection sites and everything. I keep track of every inspection site with my liaison team. When they need seats, I am happy to drop ship to them the needed seats that they need for their families that they're helping.
And as far as our program, our program is about a $88,000 budget this year. We get support from the Office of Highway Safety like everyone else, and then we do a lot of grant writing and a lot of partnering with other funders.
And I'm sure all willing to share your secrets if somebody wants to ask a question, right? They can reach out and grab your email and we will certainly pass that along. If you need contact for any one of our speakers, please reach out to Kendra at secretariat@cpsboard.org. She'll be happy to share that information. Shannon, you shared something in the chat that I thought was awesome. She said, it sounds like building spaces that are respectful and engender trust amongst community is so important to successful engagement. What piece of advice would you or any of you offer to CPS techs who are eager to make an impact on an underserved community whom they haven't worked with yet?
If you want, I can go with this. So as many of you can see, and I'm just going to call a spade here, I am a white male. And I am not necessarily in the best place to go into some of the demographics that we are serving and get a response as opposed to what we did. And that was hire staff specifically that can speak the language, that knows the culture. So if you're not in a position to do that, I would say partner with people that can. Partner with people that are part of the communities you're trying to reach, part of those backgrounds, part of those cultures, part of those speaking the languages, and let them bring you in. Work with them to bring you into those communities so that you're accepted and welcome. And then always just remember, never go in with an attitude like, let me tell you how it is. Just be open-minded. Sometimes you have to bite your tongue and, put yourself in the shoes of the people that you're serving and listen. That's the key. It's listening, because they will tell you what they need, what they fear, and where the gaps are. So I would say that.
Thank you, Nick. Juliet, I think you had something to add.
Yes, I had answered a little bit in the chat, but that's how you build trust. When you partner with other people, as I say, whatever preconceived notions you have about any demographic, you got to leave it at the door and come in, because if people feel that you're not being real with them, they're not going to be real with you. And I always have to keep in mind, these are people that are always underserved. Anytime anything is cut, when there's budget cuts, those are the first groups of people to miss out, when there's funding cuts. So when you're coming in to talk with people, you have to be real, and you don't promise things that you can never deliver on, and they can tell, they're going to want the world, but you don't say, oh yeah, we can do this. No, you tell them what you can do, what you're able to do, and deliver on that. Not make a big list and you can't do it, and they're expecting it because you've pretty much led them to believe that you can make these wishes come true. Do what you can, and you keep coming back. And if you keep coming back, that helps to build that trust, and they'll reach out to you, and you can get other organizations to come in too. You can get people at grocery stores to help out. I mean, Nick is great, and I rely on him because he can sell you anything, But it's great because as a state employee, I can't lobby, but he can. So, he's a great asset for us to have. Just like with Brent, he's a private citizen. Everyone kept telling me, oh, he's not going to work because he was a former law enforcement. I said, but people love him. They gravitate to him. And so, no, people didn't think it was going to work with hang time because he's a white male. I go, let it happen and see what happens. They love him. He connects with the people, and that's what they want to see. They want to see that you're real, you're being authentic, and you actually care. Even if you can't do anything for them, the fact that you show up in their neighborhood, willing to listen and show that you care. That's how you get in, and then that's how these programs will come about.
Many of our programs here will, if it, not including the onboarding, but after, they'll invite us to come to a community event at their community center, and it always involves a meal. Breaking bread with people is so huge. Do not skip the meal. If you get invited to go, you get there on time, you eat with these people, you let their kids crawl all over you, and then you give your presentation or you do the car seat checks, and it builds that trust and respect for you. And with them, you're on their level, you're in their comfort zone, and you're willing to be vulnerable so that they can be comfortable. And you will get hugs at the grocery store. You will see these people in public, and they will recognize you and love you, and you will love them. I mean, it's just becoming a part of their community is huge. Yeah.
And I have to agree with Jen. And here's one thing I've learned over the years by going in and doing presentations at Head Start, community events or whatever, going in there just dressed in normal clothes, okay? Not dressing above anybody. We have built so many relationships with our Hispanic communities, with our tribal nations. And I'll tell you what, when you go in there with the attitude of I'm here and I'm going to tell you everything I know and all about it and what you're doing wrong, is the wrong way to go about it, because those parents are coming to you, caregivers are coming to you for one reason, and that's to transport their kids safely and correctly each and every time. And I'll tell you what, I have learned so much from them and what their knowledge base is pretty amazing. So when we go in and we talk to, say, the tribal nations or whatever, my gosh, they have an amazing car seat programs already in place and technicians already in place. And I've learned so much from them by how to improve our own program here in Idaho. But do not think that whatever place that you're going to present or help out with, that they're not there as a caring person. And like I said, going there with your three-piece suit and your heels on is pretty professional looking, but sometimes it puts you not on a level that you can be talked to and provide a result in an ending piece to what they're there for the education.
Brent?
Yeah, I appreciate the opportunity, and I can't overstate, especially coming from 24 years law enforcement into a community with returning citizens. When Juliet speaks about trust and everything else and how a white male had to come into these inner cities, because I live in the suburbs, but it is about delivery. It's about truly being genuine. And once they get the understanding of that, you don't even have to worry about buy-in. Because right now, as we don't define ourselves as a program, we define ourselves as a family. So much so that is how we do it. And somebody comes in and says, "Oh my God, I love your program." People get upset because they don't want to be tagged with another program. They want to feel connected. And these are all basic human characteristics that anybody wants to feel. So in my recommendation to doing anything you do in this field, the first thing I tell people when I get them into my educational sessions is, "Thank you so much for coming. I love your children and I don't even know who they are yet." Because it's just the innate feeling that you have to have and passion for the job. And that brings everything down to a level where somebody's not talking. Now, and I love the idea about the clothing and everything else you wear. I put my shirt and tie on for you folks today. I don't normally wear this. Trust me, I am retired. I am in a polo type shirt and jeans. But that being said, being on a national forum, I didn't want to embarrass Juliet by any stretch. So,
Well, we appreciate the extra effort, Brent. Thank you.
I'm in such a relaxed mode. It's just a good thing. And, that's the other piece of this. When you do what you love to do, it makes such a difference. And I know all of us probably do that as opposed to making it a job. And I think that's the biggest difference. And they see it. They know it. They feel it. That's the bigger piece. It's always how you make people feel. So thank you.
Thank you. We do have a few people still on the call. Would any of you like to come off of mute and ask any questions of our speakers? You're welcome to do so, and we'd love to see you. Perhaps they're all casually dressed as well. Well, do any of our speakers have any last tidbits or last little nuggets to share? You guys have been a wealth of information today.
I thank you for letting us present. We're super passionate about our program and what we do, and we take any chance to talk about it. So I appreciate people listening to us. So thank you.
Looking forward to seeing you, Lifesaver.
I'd just like to thank you all for the opportunity. I think we do a great job here. I've gotten some really good people that we collaborate with, our stakeholders, and that makes all the difference in the world. If there's something I want to do, I pick up the phone, we pitch ideas off of one another, and then it's like, okay, make it happen. And for Nick, when they hired Rosangela, it took a while because you have to find the right people. You just can't hire anybody. Not everybody is a good fit for this. And so when he told me they finally hired somebody and I met her, I was hugging, I was like, oh, thank God, it's like, and she's fantastic. She's out in the field, ready to go. It's like, this is her passion. And it's just like with Brent, it's like, okay, yep, this is the person that I want. This is what I want to do it. And so, it's great having having collaborations like that, building up those relationships so that when you want to implement something, you have people that you trust to do it. I don't have to micromanage Yale or Brent to make sure that they're out there doing what we want them to do and the message is the same, you know.
Yep.
And so, you know, build trust is key. You have to have that trust and you have to build those relationships. And that comes over time, but you have to start somewhere. And so, you know, making that start, that helps throughout all of your traffic safety programs.
Yeah, and I will just say thank you to all of you, especially NHTSA and the NHTSA staff and organization for, you know, flowing the money through the highway safety offices in the various states throughout the country that actually support these programs, because these dollars that are being spent are saving lives and making a difference. And thank you also for patience. As Juliet said, it took me 7 months to find the right fit for that job that I talked about today. And oftentimes with grants, you know, you're worried about if you don't spend all the money, it's going to go away. Well, in this field, sometimes we don't spend all the money and sometimes we need more. And it's fluid and it fluctuates. And understanding that and having people like you all on this call that do understand it and support these programs, we're grateful.
Well, I don't want to speak for NHTSA, but I'm sure they're grateful for each and every one of you. You have really set the bar high and given us all some great examples of the work that we can do and a way that we can do it in our communities. So thank you very much. Thank you again for joining us as speakers. Amanda, did you have anything to add? I saw your happy smile on screen.
Not at all. Thank you all so much for participating today. We appreciate your support, and I'll turn it back to Mandy.
Fantastic. Well, we can go ahead and end the recording. Again, this will be available in a couple of days.